Diphtheria and Tetanus by Raquel Dunstan and Michael Denning. This quote here represents Raquel and my opinion on vaccines, and it reads, "Vaccines are the most cost-effective healthcare interventions there are. $1 spent on a childhood vaccination not only helps save a life, but greatly reduces a spending on future healthcare." We will begin with the symptoms of diphtheria. The first symptom is a sore throat, nasal discharge, difficulty breathing, swollen glands, and painful swallowing. The symptoms for tetanus are spasms, fever, stiffness in the neck and abdomen regions, and difficulty swallowing. The most recent outbreak of diphtheria occurred in 1994. Parents were rebuking the use of vaccines. They were protesting and saying they did not want the vaccines for the children. The children subsequently became sick. There was a reported 39,703 cases in 1994, compared to 1,211 cases in 1990. This occurred in the Soviet Union. On a better note, the United States has not had an outbreak of diphtheria since 2004. The most recent outbreak of tetanus occurred in Indonesia. After a very severe tsunami, the health risk of tetanus increased. A month later, 106 cases were diagnosed. The fatality rate was 18.9%, and most of the people who died were older adults. The vaccination method for diphtheria. Infants get 5 doses of the DTaP vaccine. DTaP includes diphtheria, tetanus, and pertussis, but we're focusing on the diphtheria part. They get a dose at 2 months, 4 months, 6 months, 18 months, and 6 years. They may suffer from a fever or redness afterwards. For adults, it's called a booster shot. They receive one every 10 years. Usually, the first booster shot is given between the ages of 11 and 18, and it is also recommended for women who are pregnant between the weeks of 27 and 36. Tetanus has a more simpler vaccination method. You receive a shot in your shoulder, also known as a deltoid. There's 3 doses, the TD. You receive it over 7 to 12 months, and just like the diphtheria vaccine, you receive it every 10 years for a booster shot to make sure it stays in your immune system. There has been a lot of debate over whether vaccines should or should not be used. Many people protested and said that they should not be used. The reason people say diphtheria vaccine should not be used is because it may not work. There may be a risk that it causes autism. Parents don't trust the pharmaceutical companies. They think that they're trying to get over them. Once the vaccine is done, you can't undo it. And the side effects for it is a pain in the region where the shot occurred and a low-grade fever. For tetanus, they have some of the same reasons. It may not work, may cause autism. They don't trust the pharmaceutical companies. You can't undo it. And the side effects are more extensive. They have pain in the shot area, low-grade fever, severe allergic reaction, which may include hives or difficulty breathing. Although there are people who oppose using vaccines. Raquel and I view vaccines as critical to public health, as read by this statement. We, Michael and Raquel, view vaccines for diphtheria and tetanus as critical and necessary for the continued health of individuals, groups, and the world. And the reasons we list are because they reduce outbreaks. Tetanus vaccines are cheap. They're usually about $1.30, and they also help children to stop from dying. They have proven to decrease the contraction rate of both diseases, diphtheria and tetanus. Both diseases unvaccinated can cause detrimental health risks. And lastly, there rarely are cases where there are dangerous side effects. So overall, diphtheria and tetanus are two preventable diseases by vaccines, and children should receive them. Thank you.